An unvaccinated child has died at a hospital in Lubbock in connection to the measles outbreak. This is the first measles-related death in the United States in a decade. We want to thank you all for joining us this evening. I'm Keith Garvin.
And I'm Daniela Guzman. The victim is a school-age child. According to the Texas Health and Human Services, just yesterday there were 34 newly diagnosed cases of the measles, bringing the state total to 124.
And most of the cases are out of Gaines County, but surrounding counties are seeing increases. KPRC 2's Bill Barajas is live with a possible threat from the outbreak and how you can prevent it. Bill.
The outbreak associated with the respiratory virus has been largely centered in West Texas counties, but warnings about possible infections stretch down to San Marcos and San Antonio. The death of that young child, the first U.S. measles death since 2015. The most recent cases associated with this growing outbreak in West Texas are in children ages 5 to 17.
The reason it's happening is because there's so many unvaccinated kids in West Texas. It began in a Mennonite community, which typically does not have any prohibitions against vaccines, but it began there, and now it's continuing to plow through lots of West Texas where vaccination rates are low. Once vaccination rates go down below 90% for the MMR vaccine, the measles, mumps, rubella vaccine. Measles has a good way of exploiting that.
Dr. Peter Hotez, a dean at the National School of Tropical Medicine at Baylor College of Medicine, says there are several symptoms associated with the measles.
With a constellation of symptoms, what we sometimes call the 3 C's: cough, what's called coryza, which means upper respiratory symptoms, congestion, runny nose, and conjunctivitis, redness in the eyes. And then it proceeds with a characteristic rash that starts around the face and head and neck and then extends all the way down the body, and that's when it's accompanied by high fever.
And while we have no reported cases in the Houston-Harris County area, Dr. Hotez recommends protecting yourself, especially if you plan on attending big events like the Houston Rodeo.
Well, although it's starting in West Texas, remember, of course, the rodeo brings in people from all over the state of Texas, so it's reasonable to think that there could be individuals who are shedding measles virus before they start showing the signs and symptoms at the rodeo. And the problem is that measles virus is highly infectious, and it can linger in the atmosphere for sometimes for a couple of hours, even after the person has left the venue. So if you attend the rodeo, and I would encourage all Houstonians to do it, what you need to do is make certain that you're up to date on your measles vaccinations. A single dose of measles vaccine, which you typically get around 1 year of age, is more than 90% protective, and 2 doses is 97% protective.
Dr. Hotez says the only way, again, to really protect yourself and keep your loved ones measles-free is to make sure they are vaccinated. Live in the newsroom, Bill Barajas, KPRC 2 News.